of volvulus. The twisting of the gut at least 180 degrees happens, and most of the time it is anti-clockwise. What are the causes for sigmoid volvulus? Is always an acquired disease, whereas cecal volvulus is a congenital condition. What I mean is, sigmoid volvulus happens due to congenital anomalies in the ileocecal region, leading to possibility of a twist, whereas sigmoid volvulus happens in the elderly age group, often as an acquired condition. What are the causes for sigmoid volvulus? It's a large, floppy and redundant colon with a long, narrow mesenteric base. The colon is quite long, it's floppy, and the mesocolon is also long, but the base is very narrow. In an elderly patient with constipation and hard stools, loading on the sigmoid leads to the rotation. Whereas in cecal volvulus, it's a congenital non-fixation of the ileocecal junction, so it happens in younger individuals. As I said, rotation is most of the time counterclockwise. So what are the risk factors for volvulus? Intestinal malrotation, Hirschsprung's disease where the gut is hugely dilated, enlarged colon for any other reason, pregnancy which leads to dilatation of predominantly many intra-abdominal viscera, luminal structures. Abdominal adhesions can lead to volvulus. Volvulus is seen in some neuropsychiatric disorders like Parkinson's disease or multiple sclerosis. Now, the volvulus can present with a complete or a partial colonic obstruction. Most of the times the symptoms are very non-specific like nausea, vomiting, constipation, obstipation, which is defined as non-passage of flatus and feces, and abdominal distension. Now, the specific feature of sigmoid volvulus is lower abdominal pain and upper abdominal distension. The lower abdominal pain is because of hindgut colic, and the distension, the sigmoid fills up the whole abdomen, and the distension is predominantly seen in the upper abdomen. Obviously, distension is more in sigmoid volvulus, whereas small bowel distension is very commonly seen in cecal volvulus. When the presentation is very late, you can have perforation and gangrene leading to general peritonitis. Clinically, you can feel the tenderness in the abdomen with fever and elevated WBC count